Hello everyone, welcome to another video. In today's video, I am going to talk about the pectoral region. Welcome to my channel, Dr. Sushant's Anatomy Tutorial. I'm Dr. Sushant, Associate Professor of Anatomy. So today's class is on pectoral region. The competency here is AN 9.1. Describe the attachment, nerve supply and action of pectoralis major, pectoralis minor, subclavius and serratus anterior muscles. So now, what are the surface landmarks on the pectoral region? So pectoral region is the upper part of the chest region where we have some bones covered by the skin, fascia and muscles. In today's video, I'm going to talk about the four major muscles that we find in the pectoral region. So before we go to the muscles and the other details of the pectoral region, I'd like to introduce you to the surface landmarks in the pectoral region. So what we see here in the pectoral region are some bones and impressions of the muscles, if not all, some of the pectoral region. Now we see the clavicle bone here. The clavicle bone can be seen in this part here. This is the impression of the clavicle bone. Here we have the suprasternal notch or the jugular notch. Then right here we have the sternal angle of Lewis, where the second rib articulates with the sternum. And then we have the infraclavicular fossa, just a small depression below the clavicle. Then there is the nipple and the areola. We can also see the outline of the pectoralis major muscle. So these are some of the important landmarks in the pectoral region. Now, what are the different lines of orientation? As you can see, these lines here drawn in the pectoral region and extends upwards and downwards. We should focus only on the pectoral region. So there is this sternal angle. The sternal angle is where the manubrium joins the body of the sternum, and this notch here is the suprasternal notch. And we have a line here passing through the middle of the clavicle. This line is known as the midclavicular line. This is the midclavicular line. This is the midclavicular line of the left side. This is the midclavicular line of the right side. This is the midline passing through the center of the body. And then there is a line drawn parallel to the sternum, and it's called the parasternal line. These are the lines of orientation which we see in the front of the pectoral region. In the axillary region, we have this line, anterior axillary line, which is formed by the pectoralis major muscle. And here we have the posterior axillary fold, posterior axillary line, that is basically contributed by the latissimus dorsi muscle. Between the anterior and the posterior axillary lines, there is the mid-axillary line that is passing through the middle of the armpit. These are the lines of orientation in the side, that is lateral thoracic wall, mainly in the region of the axilla. Now coming to the cutaneous innervation on the front of the pectoral region, the anterior aspect of the pectoral region, the cutaneous innervation is basically by two groups of nerves. So we have above the level of the sternal angle, alright, above the sternal angle, it is provided by the supraclavicular nerves, which derive their fibers from C3 and C4, somewhere here. So here is the sternal angle. So above this region, the cutaneous innervation is provided by the supraclavicular nerves derived from C3 and C4 fibers, And below the sternal angle, the cutaneous innervation in these regions is provided by anterior and lateral cutaneous branches of the second to sixth thoracic spinal nerves. So in the anteriorly we have T2 to T6, and laterally we have the lateral cutaneous nerves from T3 to T6, anterior cutaneous nerves. So if the question is what is the cutaneous innervation of the pectoral region above the sternal angle, it is by supraclavicular nerves which derive their fibers from C3 and C4. Below the sternal angle through the anterior cutaneous nerves derived from T2 to T6, and laterally lateral cutaneous nerves derived from the T3 to T6 spinal nerves. Next, let us talk about the superficial and the deep fascia. So let me show you this model here. So the highlighted part here is the pectoral region. This also includes an upper part of the abdomen. So when I remove the skin, so what we see here is the superficial fascia. So we already discussed what covers the skin here. What is the cutaneous innervation of this part of the skin? So we have the nerves, the thoracic nerves T2 to T6 nerves supplying this part of the skin, that is below the sternal angle, and above we have the nerves coming from C3 and C4, C3 C4 nerves in the form of supraclavicular nerves. They cross the clavicle and divide into three branches: medial, intermediate and lateral supraclavicular nerves. The lateral supraclavicular nerve supplies the shoulder region, this part here. Medial and the intermediate supraclavicular nerves supply the pectoral region above the sternal angle. Now, so now this is the pectoral region, also includes a small part of the abdomen. So when I remove the skin, we see the superficial fascia. So this superficial fascia is already removed. So superficial fascia will consist of fat. It is fibrofatty. And in females, the superficial fascia contains the mammary gland. So that's an important structure. In males also the mammary gland is present, but it is rudimentary. In females it is functional. In both sexes the mammary gland is present in the superficial fascia. So what is in the superficial fascia? So the superficial fascia is actually fibrofatty. What's the meaning? It consists of some fibers such as elastic fibers and collagen fibers. This is the connective tissue fibers basically, and basically encloses the mammary gland in both sexes. And then we also find a muscle called the platysma. So this platysma muscle is a superficial muscle which belongs to the category of panniculus carnosus. Panniculus carnosus. Similarly, the facial expression muscles also considered to be remnants of panniculus carnosus. These panniculus carnosus are subcutaneous muscles which all of us have seen in cattle while grazing in the fields. When flies sit on their skin, they move, they vibrate, they move a part of the skin to shoo away the flies. So that is because of this subcutaneous muscle known as the panniculus carnosus. So this platysma, because it is a subcutaneous muscle, you will find it just beneath the skin in the superficial fascia, is considered a remnant of panniculus carnosus, but is functional in humans. It is functional. It sweeps upwards and medially from the pectoral fascia, from which it takes its origin. So origin is from this pectoral fascia, and then it passes upwards and medially, and then it inserts to the base of the mandible over here, base of the mandible. It forms the floor of the posterior triangle of the neck and a part of the floor of the anterior triangle of the neck. So that's the superficial fascia. Now what about the deep fascia? The deep fascia of the pectoral region is known as pectoral fascia. So this pectoral fascia takes its attachment from the clavicle from the clavicle here and the sternum. Let us take a look at the pectoral fascia. This structure that is highlighted now is the pectoral fascia. So we can clearly see that the pectoral fascia takes its attachment from the clavicle above and from the sternum. So this pectoral fascia basically covers the structures of the pectoral region, mainly the pectoralis major muscle, and it passes laterally into the axilla, where it forms the axillary fascia. You can see this dome-shaped, the concave fascia here, that's the axillary fascia. This dome-shaped axillary fascia is kept suspended by the suspensory ligament of the axilla, which is a part derived from the clavipectoral fascia. After forming the axillary fascia, the pectoral fascia continues and splits again to enclose the latissimus dorsi muscle. So what is the deep fascia of the pectoral region called? The deep fascia of the pectoral region is called the pectoral fascia. What are the attachments of pectoral fascia? Pectoral fascia is attached to clavicle and sternum. What are the muscles it covers? It mainly covers the pectoralis major by splitting into layers, and at the lateral and the lower end of the pectoralis major muscle, it continues into the axilla as axillary fascia. Beyond the axillary fascia, it splits again to enclose the latissimus dorsi muscle. So that's about the deep fascia. Next, coming to the different muscles that we find in the pectoral region, there are mainly four muscles in the pectoral region. One is the pectoralis major muscle, which you can see here. This one right here. This is the pectoralis major muscle. So that's number one. You can see it is written here, pectoralis major. And deep to the pectoralis major, when you cut and reflect the pectoralis major muscle, we find another muscle lying deep to the pectoralis major, that's the pectoralis minor muscle. So this is your pectoralis minor muscle, second muscle. And then we also have another small muscle above the pectoralis minor beneath the clavicle, that's the subclavius muscle. This is number 3. And then there is one more muscle that has a serrated origin from the upper 8 ribs. This muscle here is the serratus anterior. So these are the muscles that we find in the pectoral region. Now let us just list the muscles that are found in the pectoral region. We find the pectoralis major muscle. That's the most superficial and the largest muscle of the pectoral region. Then we find the pectoralis minor muscle. The pectoralis minor muscle lies deep to the pectoralis major muscle. Then we have the subclavius muscle. Then there is the serratus anterior muscle. So these are the four muscles that we find in the pectoral region. So we will talk about each of these muscles in detail. Now these are the locations. Let me show you the muscles again. So this is the deep fascia. That's the pectoral fascia is highlighted now, and this is the platysma muscle. This muscle has got a very thin layer of muscle fibers that passes superficial to the clavicle to be inserted to the base of the mandible, and it takes its origin from the pectoral fascia. It lies in the superficial fascia. Okay. Now, deep to the platysma is the deep fascia, as the pectoral fascia. We just discussed the deep fascia of the pectoral region. Now, if I remove the deep fascia, we can see the muscle. So this is the pectoralis major muscle. This right here is the pectoralis major muscle with its origin and insertion. You can see the origin is broad and the insertion into the humerus is narrow. Now if I cut and divide the pectoralis major muscle, so what will I see deep to it? So deep to the pectoralis major muscle, I will see the pectoralis minor muscle covered by the clavipectoral fascia. Now look at this. So this is the clavipectoral fascia. Basically, the clavipectoral fascia is it extends from the clavicle to the pectoralis minor muscle. We will talk about it in detail in a bit. So this basically covers two muscles, pectoralis minor and the subclavius muscle, and it is basically pierced by four structures going in or coming out of the axilla into the arm, or arm into the axilla. All right, so that's the clavipectoral fascia. Now the muscle that you see deep to the clavipectoral fascia, this one right here, this is the pectoralis minor muscle. This is the pectoralis minor muscle, is again a triangular muscle, lies deep to the pectoralis major muscle. That's our second muscle. Now the third one lies here deep to the platysma. Let us remove the platysma so that the subclavius muscle will be visible to us. Look at this muscle right here. This is the subclavius muscle. This one, the subclavius muscle, goes from the first costochondral junction to the subclavian groove that's present on the middle third of the shaft of the clavicle on its inferior surface. So this is a third muscle, subclavius. And we have one more muscle that is in the lateral thoracic wall here, covered by a fascia. So the fascia here, that's called the deep abdominal fascia. Deep abdominal fascia. So when I hide the deep abdominal fascia, here more laterally, I can see a muscle called the serratus anterior muscle. This muscle here is the serratus anterior. Look at the origin. It has a serrated origin. That's why it's called the serratus anterior. Right. So that's the fourth muscle. So these are the four muscles that we find in the pectoral region. Right. Now we will do one thing. We will look at each muscle, all right, layer by layer, and that will help us understand the attachments of all the muscles in the pectoral region. So first muscle, we are under what headings we will discuss any muscle. So we will be discussing the muscle under four headings. That is origin. Origin of a muscle is always important. Insertion of the muscle, nerve supply of the muscle, and action of the muscle. Any muscle you take for that matter should be discussed under these four headings. First, let us talk about the pectoralis major muscle. The muscle that is highlighted in purple color here. This is the pectoralis major muscle, most superficial muscle of the pectoral region. You can see with its origin. This is this broad origin of the pectoralis major muscle, and the muscle narrows down to form this tendon. So like I already told you, the pectoralis major muscle is the largest muscle of the pectoral region. So what is the shape of the muscle? It is thick. It's much thick muscle, and it is a nearly triangular in outline, somewhat, okay, roughly triangular in shape, and it has got a broad origin, and it has got a very narrow insertion. And also we have to understand that this forms the anterior wall of the axilla. So deep to the pectoralis major and minor will be the axilla. So one of the structures forming the anterior wall of the axilla is the pectoralis major muscle. So there is a region here that is known as the delta pectoral groove, which lies between the anterior fibers of the delta. This muscle here is the deltoid, and the superior fibers of the pectoralis major muscle. This is known as the delta pectoral groove. So lying in the delta pectoral groove is the cephalic vein, right? Cephalic vein. And close to the delta pectoral groove, we can see the twisted fibers of the pectoralis major muscle, right? So this twisted lower border of the pectoralis major muscle forms the anterior axillary fold. So the anterior wall of the axilla is different, anterior axillary fold is different. The entire muscle with the pectoralis minor clavipectoral fascia forms the anterior wall of the axilla, whereas the lower of twisted fibers of the pectoralis major muscle forms the anterior axillary fold. Now let us talk about the attachments of the pectoralis major muscle. Attachments in terms of origin and insertion. Now when we look at the pectoralis major muscle, it has got two heads of origin. A part of the muscle takes its origin from the clavicle and remainder from the sternum and the costal cartilages, and a part from the aponeurosis of the external oblique muscle. So accordingly, we have two heads of origin. One is the clavicular head of the pectoralis major. The second one is sternocostal head. So the second one, we can understand that it arises from a part of sternum and also from the costal cartilages and the ribs. Okay. Now let us look at the clavicular head of the pectoralis major muscle. Now here is the pectoralis major muscle. So there is a part of pectoralis major taking origin from the clavicle, that is called the clavicular head. So which part of the clavicle? Anterior surface of medial half of the shaft of the clavicle. So that's the clavicular head of pectoralis major muscle. Anterior surface of medial half of shaft of the clavicle. Next we have the sternocostal head. So it has got fibers arising from the sternum and fibers arising from the costal cartilages. Now as you can see here, the manubrium is seen. The manubrium is the upper segment of the sternum. The middle segment of the sternum is the body, and the lower segment is the xiphoid process. Now the sternocostal fibers arise from anterior surface of a lateral half of the sternum up to the level of 6th costal cartilages, right? So 1 2 3 4 5 6. So this is the 6th costal, this is the 6th rib. It's costal cartilage, okay, not the rib, it's costal cartilage. So from the sternum, the pectoralis major muscle takes its origin up to the level of the 6th costal cartilage, right? And also it takes origin from the 2nd to 6th costal cartilages. So the cartilages are not shown in this picture, only the ribs are seen. So the gap between the sternum and the ribs, that's where you will have your costal cartilages. So the pectoralis major takes origin from the costal cartilages, and also it takes its origin from the external oblique aponeurosis. So this white portion you see, that is the muscle taking, that is pectoralis major muscle taking origin from the aponeurosis of external oblique. Now let us list the origins of pectoralis major muscle. I hope this is understood. So the pectoralis major muscle arises by two heads, okay? One is the clavicular head. The clavicular head arises from anterior surface of medial half of shaft of clavicle. That's the clavicular head, right? Clavicle. Next, the second head is known as the sternocostal head. The sternocostal head. So part of it takes origin from the sternum. So from the sternum, from the anterior surface of lateral half, not one and a half, lateral half of sternum, that is from manubrium and the body up to the level of which one? 6th costal cartilage. And then we also have the pectoralis major taking origin from the 2nd to 6th costal cartilages, and lastly cartilage, and lastly from the aponeurosis of which muscle? External oblique muscle. That's a muscle of the anterior abdominal wall. So now these are the origins of the pectoralis major muscle. Now what are the insertions, right? So the muscle passes upwards and lateral, as you can see, right? Upwards. It passes in this direction, the fibers. And the fibers converge here, forming two layers. So the insertion is referred to as bilaminar. So what is this bilaminar? A few fibers of the pectoralis major forms one layer, and the remainder fibers form another layer. So these two layers come together close to the insertion, and then they get twisted, forming a tendon of about 5 centimeter broad. Roughly 5 centimeter broad tendon it forms, and this tendon then gets inserted to the bicipital groove, which is here in the arm. Okay, so now the mode of insertion is by forming a flat bilaminar tendon. That's very important. A flat, let me choose a color that is visible. So it forms a flat, this is important, bilaminar. It forms a flat and bilaminar tendon. It consists of the anterior lamina, like I already told you, the anterior lamina. Okay, so there is the anterior lamina. So the anterior lamina of the pectoralis major muscle is basically derived from the clavicular head. Okay, so anterior lamina is the clavicular head. So the fibers coming from the clavicle form the anterior lamina of the pectoralis major muscle towards its insertion. The posterior lamina, it is basically formed by the sternocostal and the aponeurotic fibers, right? So remainder, the sternocostal fibers and the fibers from the external oblique aponeurosis, so that forms the posterior lamina. And close to the insertion, this bilaminar, what is it? Bilaminar tendon of the pectoralis major is about 5 centimeters broad, and then it inserts in a U-shaped manner. Okay, it inserts in a U-shaped manner, meaning here is the anterior lamina, here is the posterior lamina. So these lamina become continuous with each other. At the lower border, these fibers become continuous. Actually, here they become continuous with each other. So in an U-shaped manner, there is no gap here. This gap isn't there, just for the sake of representation. So these two layers come together, anterior lamina in front and posterior lamina behind, and the lower border, they become continuous. And also you have to remember that the posterior lamina becomes twisted, right? So that the fibers taking origin from the upper part becomes lower fibers, and the muscle taking origin from the lower part becomes upper fibers. So there is crossing of these fibers, twisting of the fibers. You can imagine how a sheet is twisted, so that the upper border becomes lower border, lower becomes upper border. So the posterior lamina gets twisted actually. Then they both get inserted to something called lateral lip of bicipital groove. So what is this bicipital groove? Bicipital groove is also known as intertubercular sulcus, right? So let me show you what this intertubercular sulcus is. So this intertubercular sulcus is here. That's where the muscle is inserting. So in this picture, we can see intertubercular sulcus. This is the upper end of the humerus, right? Upper end of the humerus. So you can see this is the head of the humerus that is articulating with the glenoid cavity of the scapula to form the shoulder joint. So this is the shoulder joint. Here is the lateral end of the clavicle, is the acromion process. This is the coracoid process. Now here is a bony projection of the upper end of the humerus known as the greater tubercle. Here is a small projection of the upper end of the humerus known as the lesser tubercle. Now between the greater tubercle and lesser tubercle, there is a elongated gutter-shaped depression. This is called the bicipital groove, also known as the intertubercular sulcus. So I hope you know the meaning of sulcus. So it is an elongated depression. Now here is the greater tubercle, this is the lesser tubercle. Because it is between the tubercles, it is called intertubercular sulcus. Now the intertubercular sulcus has got a medial lip. This is the medial lip because it is closer to the midline. This is the lateral lip which is away from the midline, and there is a floor also. Now the pectoralis major muscle will be inserted to the lateral lip of the bicipital groove. So this is where the pectoralis major muscle is going to get inserted. Right. So as the muscle passes laterally, in this picture as you can see, it passes laterally and then it comes and inserts to the lateral lip of the bicipital groove. So the bilaminar tendon can be seen here. The twisting of the fibers can be seen here. This twisting in the lower border, and the fibers come together to laminae, and here is the bicipital groove. Okay, so the greater tubercle, the lesser tubercle, both are seen. The space between the two is the intertubercular sulcus. The lateral lip of the bicipital groove, that's where the pectoralis major muscle is inserted. Well, that's the pectoralis major muscle origin and insertion. Right. Now, why it is also known as bicipital groove? This is known as bicipital groove because the tendon of the biceps brachii, the long head of tendon of biceps brachii, lies in the groove. That is why this groove is actually due to the pulling action of the long head of biceps brachii muscle. Coming to the innervation of the pectoralis major muscle. What nerve supplies the pectoralis major muscle? So there are nerves known as pectoral nerves, right? So there is the lateral pectoral nerve, there is medial pectoral nerve. So these nerves come from the brachial plexus. So we will discuss the brachial plexus in a separate video. In this video, you only have to remember that the pectoralis major and minor muscles both are supplied by lateral pectoral nerve and medial pectoral nerve. And remember that the lateral pectoral nerve comes from the lateral cord of brachial plexus, and the medial pectoral nerve comes from the medial cord of brachial plexus. Right. Now here is a picture of the brachial plexus. So we know that the brachial plexus has got parts which are known as roots, the trunk, the divisions, anterior and posterior divisions, then we have the cords, then we have the terminal branches. So we have R, T, D, C, B, right? Now the roots of the brachial plexus are the C5 root, C6 root, C7 root, C8 root, and T1 root. Okay, so these roots join and form the trunks. So here we can see the superior trunk, which is formed by the joining of C5 and C6 roots. They two together form the superior trunk. The C7 root continues as the middle trunk, and C8 and T1 join and form the inferior trunk of the brachial plexus. Soon the trunk divides into divisions, right? Anterior, posterior divisions. Each trunk can be seen dividing into the divisions. So after forming the divisions, they come together forming the cords. Here we can see the lateral cord, which is formed by the joining of anterior division of superior and middle trunks. The anterior division of the lower trunk continues to form the medial cord. The posterior divisions of all the three cords come together to form the posterior division. Right. Now from the lateral cord of the brachial plexus, you can see the lateral cord of the brachial plexus, we have this nerve coming, that's the lateral pectoral nerve, which derives its fibers from C5, C6, C7. So C5, C6, C7. That's the lateral pectoral nerve. The lateral pectoral nerve supplies the pectoral muscles, the pectoral major and minor muscles, after piercing the clavipectoral fascia. Now, the medial pectoral nerve comes from the medial cord of the brachial plexus. Here we can see the medial cord, and here is the medial pectoral nerve. The medial pectoral nerve, this one comes from the C8 and T1. So the root value of medial pectoral nerve is C8, T1. Root value of lateral pectoral nerve is C5, C6, C7. So what is the nerve supply of the pectoral muscles? Lateral pectoral nerve and medial pectoral nerve. The medial pectoral nerve first pierces the pectoralis minor, supplies it, and then supplies the pectoralis major muscle from its deep surface or undersurface. Right? So here the medial pectoral nerve is seen piercing the pectoralis minor muscle, then supplying the pectoralis major muscle. So here is the lateral pectoral nerve after piercing the clavipectoral fascia, supplying the pectoralis major and minor muscle. So two things to remember. The pectoral muscles, that is major and minor, are supplied by the medial and lateral pectoral nerves. The lateral pectoral nerve comes from the lateral cord of the brachial plexus. Medial pectoral nerve comes from the medial cord of the brachial plexus. The lateral pectoral nerve has the root value C5, C6, C7, and the medial pectoral nerve has the root value C8, T1. The lateral pectoral nerve pierces the clavipectoral fascia and then supplies the pectoralis major muscle, whereas the medial pectoral nerve supplies the pectoralis minor and then supplies the pectoralis major muscle. So these are the innervations of the pectoralis major. Now coming to the actions of the pectoral muscles, right? When the whole muscle is acting, meaning the entire muscle, okay? So speaking of the actions of pectoral muscles, okay? Now the whole muscle, meaning the both clavicular head and sternocostal head is acting. All the muscle, the entire muscle is acting together. It causes the adduction and medial rotation, okay, of the arm. So you can imagine this muscle getting shortened, the pectoralis major muscle getting shortened. When it gets shortened, it will obviously adduct the arm, and because it is inserted to the lateral lip, the contraction will rotate the humerus medially. Therefore, the action of pectoralis major muscle as a whole is adduction and medial rotation of the arm at the shoulder joint. Now, when you consider only the clavicular fibers, you can imagine only the clavicular fibers contracting, and they cause the flexion of the arm at the shoulder joint. Flexion of the arm at the shoulder joint, only the clavicular fibers, as in pushing. So you can try to push something if you're sitting and there is a table in front of you. Try to push the table. So when you try to push the table, you're actually flexing your shoulder joint, that is arm at the shoulder joint. So the flexion of your shoulder is mainly because of the contraction of the clavicular fibers of the pectoralis major muscle. Now, what about the sternocostal head? Only sternocostal head is contracting, let us imagine. So this causes the extension of the arm against resistance, as in climbing. So when you lift your arms above, right, pulling your body upwards through a rope, okay, climbing up a rope, you can imagine that you're pushing your body upwards, right, against the weight of your own body. What happens now is your arm extends, it goes backwards, right, against your weight. So that is extension against resistance. Or you can ask your friend to push your arm from behind, and you try to extend your arm, push your arm, okay. So that's the action of the sternocostal fibers, which is extension of the arm against resistance, as in climbing. And also the pectoralis major muscle is an accessory muscle of respiration. So these are the actions of the muscle. So as a whole, it helps in adduction and medial rotation. Only the clavicular fibers flexion of arm at shoulder, as in pushing, right? When you are trying to push, as in pushing. Whereas the sternocostal fibers will be contracting when you are trying to extend your arm against resistance, as in climbing, right? When you are climbing up a rope, or so that is as in climbing. Okay, you can imagine yourself pushing your body upwards as you climb up a rope. Okay, so these are the actions of the pectoralis major muscle. Now coming to pectoralis minor muscle, the pectoralis minor muscle is found deep to the pectoralis major muscle. This muscle is also a triangular muscle. As you can see, its outline is triangular. This highlighted muscle, this is triangular in shape, and this muscle actually divides the axillary artery into three parts. Okay, so deep to the pectoralis minor major, we find the pectoralis minor muscle. So this pectoralis minor muscle is going to divide the axillary artery into parts. All right, so here is the axillary sheath that covers the axillary vessels and cords of the brachial plexus. So when I remove it, I can see the axillary vein, which is actually, it lies medial to, ventromedial to the axillary artery. So here is the axillary artery. You can see this is the axillary artery. So it is divided by the pectoralis minor muscle into three parts. A part that lies superior to it or medial to it, as a part that lies deep to it or posterior to it, and a part that lies inferior to it or lateral to it. So three parts are there for the axillary artery. So the pectoralis minor muscle divides the axillary artery into three parts. Okay, so how does it divide? So here is the the axillary artery. Okay, and then we have the pectoralis minor muscle taking origin by three heads. So this is how the pectoralis major muscle, minor muscle, is going to divide the axillary artery into parts. So when we have to represent a part that lies posterior to something, we represent it by dotted lines. So it means that the structure in dotted lines is present behind, okay, or posterior to. Now here is the first part of axillary artery that lies medial to or superior to the pectoralis minor muscle. This is the second part of the axillary artery that lies deep to or posterior to the pectoralis minor muscle, and this is the third part of axillary artery that lies inferior or lateral to the pectoralis minor muscle. Right, so this is how the axillary artery is divided by the pectoralis minor muscle. Now let us talk about the covering of the pectoralis minor muscle. The pectoralis minor muscle is covered by what is called clavipectoral fascia. Right, it is covered by clavipectoral fascia. Also, we have to remember one more point here. So the superior border of the pectoralis minor muscle is accompanied by the superior thoracic artery, and the inferior border is accompanied by the lateral thoracic artery. Right, so the lateral thoracic artery actually is a branch of the second part. So here is pectoralis minor muscle, here is third part of axillary artery. So here is the lateral thoracic artery, which is actually coming from the second part. So this artery is superior thoracic artery, which is from the first part of the axillary artery, and this is the lateral thoracic artery, which is from the second part of the axillary artery. Right. So the relations of the pectoralis minor is important. Its relation with the axillary artery and the arteries that run along its upper and the lower borders. So this is the relations. Now coming to the attachments of the pectoralis minor muscle. So the pectoralis minor muscle, it takes its origin from the third, fourth, fifth ribs. Okay. So 3, 4, 5 ribs. Right. So third, fourth, fifth ribs. You can see clearly it's not from the costal cartilage. It arises from the third, fourth, fifth ribs and also from the intervening fascia. And then the muscle passes upwards. Let us highlight this muscle. Isolate the muscle actually. So you can see the origin is from the third, fourth, fifth ribs, and the muscle passes upwards and laterally. And then it inserts here to the medial border and superior surface of the coracoid process of the scapula. Alright. So that's the origin and insertion of the pectoralis minor muscle. We already discussed the nerve supply of the pectoralis minor muscle, medial and lateral pectoral nerves. This picture shows you the relationship between the axillary artery and the pectoralis minor muscle. I already explained this. This is the first part, second part, and third part of the axillary artery. The innervation. So what is the nerve supplying the pectoralis minor? Pectoralis minor and pectoralis major both are supplied by medial and lateral pectoral nerve. Next, third small muscle is the subclavius muscle. Subclavius muscle is a tiny muscle, right? So this tiny muscle is triangular in shape. Okay, it's a triangular muscle basically. And it takes its origin from the costochondral junction of the first rib. Okay, let us look at this individual muscle in the atlas. So this one right here, this muscle lies deep to the platysma. So here is the subclavius muscle. Now what is the origin of subclavius muscle? The subclavius takes origin from the first costochondral junction. That is where the first rib meets its costal cartilage. That's the origin point of subclavius. And it is inserted to the subclavian groove, which is present on the inferior surface of middle third of the clavicle. Right? So that's the origin and insertion of the subclavius muscle. It's a very easy muscle, very small muscle. Right? Now, so that's the origin and insertion of the subclavius muscle. Well, now what is the nerve supply of the subclavius? The subclavius muscle is supplied by the nerve to subclavius. Right? The nerve is called nerve to subclavius. Nerve to subclavius. Right? So this nerve to subclavius actually is a branch of the upper trunk of the brachial plexus. In this picture, we can see that here is the upper trunk of the brachial plexus, middle trunk, lower trunk. So the upper trunk is formed by C5, C6 roots and soon divides into an anterior division, posterior division. And then at this point we have two nerves actually. One is the supraclavicular nerve. This one is the supraclavicular nerve. This is the nerve to subclavius. So basically the nerve to subclavius arises from this point known as the Erb's point. So Erb's point is where we have the nerve to subclavius taking its origin from. The Erb's point is nothing but it's a meeting point of 6 nerves. Which are 6 nerves? The C5 root, C6 root, anterior division, posterior division of the upper trunk, and supraclavicular nerve and nerve to subclavius. So this point here is known as this point is the Erb's point. So that is where we have the nerve to subclavius taking its at origin from, and it will have fibers from C5 and C6. It carries it with it C5 C6 fibers. Okay, so now what is the action of the subclavius muscle? It basically steadies the clavicle during the various movements of the shoulder. Okay, mainly it pulls the the clavicle inferiorly and medially. Okay, during the movements of the shoulder, it pulls it inferiorly and medially. So this is the subclavius muscle. Then one more last muscle in the pectoral region is the serratus anterior muscle. So strictly speaking, it's not a muscle of the pectoral region. It's actually a broad sheet of muscle that forms the lateral wall of the, that's found on the lateral wall of the thorax. And it is covered by a relatively thick sheet of deep fascia. All right. So why it is considered with the upper limbs? Because it contributes partly to the medial wall of the axilla. It is inserted to the scapula, which is one of the bones of pectoral girdle. So for functional reasons, the serratus anterior is discussed with the muscles of the upper limb. Now, why it is called serratus anterior? Because it has got this serrated origin, like teeth of saw. That is why it is called serratus anterior. Now, let us talk about the origin of the serratus anterior. So, the serratus anterior arises by 8 fleshy slips. Okay, it has 8 slips of origin. Let us look at the muzzle. See, here is the muzzle, serratus anterior. Now, if you count the number of slips it takes its origin from by, okay, so you can see 1 2 3 4 5 6 7 8 slips are there. So the origin is from the outer surface and upper border of upper 8 ribs, meaning 1 2 3 4 5 6 7 8 ribs, and it's not from the costal cartilages. Outer surface, upper border of upper 8 ribs. That's the origin, right? So let us write down the origin of the serratus anterior muscle. So this is an interesting muscle, serratus anterior. It is also known as the boxer's muscle. Okay, so you will find out why it is known as the boxer's muscle. It's mainly because of its action. So its origin is from upper 8 ribs. That is basically from outer surface and upper borders. Okay, upper border of upper 8 ribs. That's the origin. It also takes origin from the fascia that covers the intervening intercostal muscles. That's the origin of serratus anterior muscle. So after its origin, it sweeps upwards and backwards. It passes upwards and backwards. As you can see in this picture, it passes upwards and backwards. It passes deep to the scapula, and then it inserts to the medial border of the scapula along its ventral surface. See, the medial border of the scapula along its ventral surface or the costal surface. That's the insertion of the serratus anterior. I'd like to add few more details to the origin and insertion of the serratus anterior. So the origin of the serratus anterior is described as it arises from the outer surface of outer surface and upper border of upper 8 ribs. Here, the first slip of serratus anterior takes its origin from outer border of first rib, and a part of
first digitation arises from a rough impression of the second rib. So what is the meaning? So the first slip of serratus anterior not only takes origin from the first rib but also from the second rib, right? So the first rib is placed horizontally, nearly horizontally. So it has an outer border, inner border, superior surface, inferior surface. Unlike the second and the other ribs, which are slightly twisted and are placed slightly obliquely, so that they have an upper border, lower border, inner surface, outer surface. So this has to be kept in mind. And also adding more details to the insertion of the serratus anterior. Now the first digitation of the serratus anterior will be inserted to the area along the medial border. Okay, inserted. The entire muscle is inserted to the medial border on the costal surface of the scapula. Okay, that is clear. Now the first digitation extends from or inserted from a point on the superior angle. So extends from the superior angle to the root of spine. So that's the insertion of the first digitation. So let me draw the scapula here. The scapula, this. Okay. So is the superior suprascapular notch. Here is the spine with the acromion process of the scapula, and here we have this one, and then we have the coracoid process. Now the insertion of the first slip, alright. So we know that this is known as the superior angle of the scapula. This is the lateral angle. This is the inferior angle of the scapula. Now the first digitation is inserted to this is the dorsal surface, okay? So what we are looking at now is the dorsal surface. Remember that the insertion is to the medial surface, costal surface. So from here to here, that is from the superior angle to the root of the spine. So because I wanted to show you the root of spine, I drew the dorsal surface. So this is the dorsal surface, but remember, insertion is into which surface? Insertion is to the costal surface and not to the dorsal surface. Okay, so the first digitation will be inserted from the superior angle up to the root of the spine on the ventral surface along the medial border. Okay, now the remaining digitations. So here is the first digitation, remaining second, third, okay, sometimes the fourth one will be inserted again to the medial border along the costal surface. Okay, like the second, third, fourth. Now the last 4 digitations, that is fourth one, if it is not inserted here, 5, 6, 7, 8, they all converge here to a large triangular impression close to the inferior angle of the scapula. So along a triangular area. So this is the insertion of the serratus anterior muscle. Okay, so this first digitation is supplied by the C5 root. The remaining, these fibers are supplied by the C6 root, and these fibers are supplied by the C7 root. So the nerve supplying the serratus anterior is the long thoracic nerve. It's the long thoracic nerve having the root value of C5, C6, C7. It is also known as the nerve of Bell because of its action. I'll explain the action next. So that's the origin and insertion nerve supply of the serratus anterior muscle. Now coming to the actions of the serratus anterior muscle. Alright. Now the serratus anterior muscle, the nerve to the serratus anterior, the action of the serratus anterior muscle is that it is going to rotate the scapula forwards. That is known as the protraction of scapula. This is when the entire serratus anterior muscle is contracting, okay, along with pectoralis minor muscle. Okay, now what is the action of pectoralis minor muscle? The pectoralis minor muscle along with the serratus anterior muscle protracts. Okay, I believe I forgot to mention the action of the pectoralis minor when I discussed the pectoralis minor muscle. So when you talk about the actions of the pectoralis minor muscle, it has mainly two actions and one accessory action. The main action is protraction, meaning forward rotation of the scapula together with serratus anterior. Okay, it is not the pectoralis minor doing this action alone, it is along with the serratus anterior. Second action is depression of the point of the shoulder, depression of shoulder. Third, it's an accessory muscle of respiration. Okay, kindly excuse me for not mentioning the action of pectoralis minor when I discussed pectoralis minor. Please consider the action of pectoralis minor. I'm discussing it here. These are the actions of pectoralis minor muscle. Now, when we are talking about the actions of the serratus anterior muscle, so the protraction of the scapula is a major function or the action of the serratus anterior muscle together with the pectoralis minor. So this is as in punching. Now try to punch as you're sitting here listening to this video. Try to punch, right? When you try to punch, your scapula is rotating forwards. So this punching action, because of this punching action, serratus anterior is known as the boxer's muscle. Okay, so this is assisted by pectoralis minor. So this is called the boxer's muscle. All right, that is one of the actions. Right, another action of the serratus anterior is mainly by the lower 4 or 5 digitations of the serratus anterior along with lower fibers of trapezius muscle. Trapezius muscle is found on the back, lower fibers of trapezius. I will show you the muscle. So the trapezius, it helps in the overhead abduction of the arm. Overhead abduction. What is overhead abduction? We know abduction. So the initiation of the abduction is done by the supraspinatus muscle, that is from 0 to 15 degree. 15 degree to 90 degree abduction is done by the middle or the acromial fibers of the deltoid above 90 degrees. Right? Please try to abduct your arm above your head. That is called overhead abduction of the shoulder. So the overhead abduction of the shoulder is actually done by serratus anterior together with the lower fibers of the trapezius muscle. Now we know why the nerve supplying serratus anterior is known as nerve of bell. You have to overhead abduct to ring the bell, right? Church bell. So that is why the nerve of bell. Okay, so that's the serratus anterior muscle. So the serratus anterior muscle, as it contracts, it keeps the medial border of the scapula closely attached to the thoracic wall. Okay, so it's the medial border or the also known as the vertebral border of the scapula. It is kept firmly in contact with the chest wall due to the contractions of the intact serratus anterior, When there is injury of the long thoracic nerve, the pectoralis, the serratus anterior muscle, the medial border of the scapula becomes more prominent, which is known as the winging of scapula. So what is winging of scapula? I will show you the picture of the winging of the scapula. That is, the medial border of the scapula becomes prominent due to paralysis of serratus anterior, because it fails to keep the medial border or the vertebral border closely in contact with the thoracic wall, right, due to injury of the long thoracic nerve. Now, how does the long thoracic nerve supply the serratus anterior? The long thoracic nerve, it arises from, so this is the nerve supply. It comes, the long thoracic nerve, also known as nerve of Bell. The root value of this are C5, C6, C7, right? So this nerve enters the axilla, okay, through the cervico-axillary canal, which is the apex of the axilla, right, which is bounded by the first rib, and then we have the superior border of the scapula posteriorly, and we have the clavicle, right? So this is known as the cervico-axillary canal. So through the cervico-axillary canal, we have the axillary artery, axillary vein, cords of the brachial plexus, some lymphatics passing through from the root of the neck into the axilla, or from the axilla into the root of neck, because this forms the apex of the axilla. So we have the nerve of Bell, or the long thoracic nerve, passing through the axilla, through the apex of the axilla, entering the axilla, and it is covered by the deep fascia that covers the serratus anterior muscle, and this nerve runs posterior to the mid-axillary line, okay, posterior to mid-axillary line. So this nerve runs posterior to the mid-axillary line. All right. Now, so that those are the four muscles of the pectoral region. So the serratus anterior muscle can be seen inserting to the medial border of the scapula along its the ventral surface, medial border, ventral surface. Right. Next, let us look at what is more in the pectoral region. So the nerve supply we discussed, nerve supply, and the clavicle and the scapula. You can see the muscle here, the subscapularis muscle, the undersurface, okay, the clavicle with the different muscles that are attached to it. Because it is not relevant here, I'm not discussing further. Now, another important structure that we find in the pectoral region is the clavipectoral fascia, right? So this clavipectoral fascia is actually a strong sheet of fascia, right? Clavipectoral fascia, it's a strong sheet of fascia. It lies deep to the clavicular head of pectoralis major, right? It lies deep to the clavicular head of pectoralis, and it extends between the pectoralis minor and the clavicle. And here is the pectoralis minor muscle, is the clavicle. So between this we find this clavipectoral fascia. So in this region found is the clavipectoral fascia. This is an important fascia. So medially, what happens to the clavipectoral fascia? It is attached to the first rib and the costoclavicular ligament, and it fuses with the intercostal membrane of the first two spaces. You see this white membrane-like structure? That is the anterior intercostal membrane. So the clavipectoral fascia medially blends with the intercostal membrane of the upper two spaces, and also with the costoclavicular ligament that extends from the first costal cartilage to the inferior surface of the, close to the medial end of the shaft of the clavicle. Now what happens laterally? Laterally, the clavipectoral fascia is actually attached to the coracoid process, right? As you can see here, it is attached to the coracoid process. The coracoid process is here. So lateral attachment of the clavipectoral fascia, it attaches to the coracoid process. and it blends with the coracoclavicular ligament. So extending between the lateral end, that is conoid part and trapezoid part of the inferior surface of lateral one third of the clavicle, there are these two bony projections. From there to the coracoid process, there is a ligament that is called that is known as the coracoclavicular ligament. So laterally, the clavipectoral fascia blends with the coracoid process and attached to the coracoid process blends with the coracoclavicular ligament. Now what happens to the clavipectoral fascia above? Let us look at this picture here above. So here is the pectoralis minor muscle, here is the subclavius muscle. So after covering the pectoralis minor muscle, the clavipectoral fascia, it splits into two layers. Okay, splits into two layers, and then it will be attached to the two lips of the subclavian groove. So where is the subclavian groove? It is on the inferior surface of middle third of the clavicle. That's where we have the subclavian groove. So the clavipectoral fascia will be attached to the anterior and the posterior layers of the clavipectoral fascia will be attached to the anterior and the posterior lips of the subclavian groove. I believe you remember the subclavian groove. So where is the subclavian groove? Let me show you. So the clavicle bone. Okay, the clavicle bone here is the clavicle. So when you look at the inferior surface of the clavicle, in the middle thirds, we see this groove here. That is for the insertion of the subclavius. And this groove has got an anterior lip and a posterior lip. So the two layers of the clavipectoral fascia will be attached to the anterior and the posterior lips of the clavicle, subclavian groove of the clavicle. So if I simply draw a diagram of the clavicle, so I'm taking, so this is the medial end of the clavicle, the clavicle, the sternal end, which is convex in the anterior two-third. We have the lateral end, the clavicular end. So this part here, this is cylindrical, medial two-third. On its under surface, this is the under surface, middle part, there is a groove. This is the subclavian groove. That is where we have the subclavius muscle inserted. Okay, so if you consider this as anterior, this is posterior. So along this line is the anterior lip of the subclavian groove, along this is the posterior lip. Now if I take a section at this level, so I will see the clavicle here, right, the clavicle, and then I will see the subclavius muscle that is inserted to the subclavian groove, and the two lips of the subclavian groove, anterior and posterior. Let us consider this anterior and posterior. So we have the anterior layer of the clavipectoral fascia, posterior layer of the clavipectoral fascia. So this clavipectoral fascia continues here between the subclavius, that is the clavicle, and here I can see the section of the pectoralis minor muscle. So this is the pectoralis minor muscle. So at the upper border of the pectoralis minor muscle, the clavipectoral fascia splits again, covering the anterior and the posterior surfaces of the pectoralis minor muscle. Again, at the lower border of the pectoralis minor muscle, the two layers fuse, forming a single sheet. This single sheet is known as the suspensory ligament of the axilla, which keeps the floor of the axilla, which is dome-like, pulled upwards. Right? So this is the axilla. This is the floor of the axilla. This armpit, if you just insert your fingers into your armpit, where you have the axillary hair, that's the floor of the axilla, and it is dome-like, it is convex into the axilla, and this convexity is maintained by something called the suspensory ligament of the axilla, which is formed by the extension of the clavipectoral fascia. So typically this is called the clavipectoral fascia, extending between the pectoralis minor muscle and the clavicle. But if you trace it below, we can see that at the upper border pectoralis minor splits into two layers, an anterior lamina, posterior lamina. And at the lower border fuses again, forming suspensory ligament of the axilla that keeps the dome of the axilla, floor of the axilla pulled upwards. Now when you trace the anterior lamina of the clavipectoral fascia, it blends with the clavicle. The posterior lamina continues further upwards, okay, and it anchors the inferior belly of omohyoid. The inferior belly of the omohyoid, it keeps it anchored to the clavicle. Okay, don't worry about omohyoid. It's a muscle you find in the triangles of the neck. It has got two bellies are there. There is a superior belly, there is an inferior belly. So the inferior belly, so this muscle, when you look at it, maybe I can show you this muscle in the atlas. So anyway, so let us try to find the omohyoid muscle. Okay, omohyoid muscle, which you find here in the neck. It's the platysma. And remove the platysma. This is actually not very important, okay, for our discussion here. You can see here is a muscle, this one. This is the omohyoid muscle. You see, is the omohyoid muscle. So this white part here, this is the junction between the superior and the inferior belly. One that is above superior belly, one below is the inferior belly. Now you can see the inferior belly is very close to the clavicle. So the inferior belly is anchored to the clavicle by the extension of the posterior layer of the clavipectoral fascia. This is the section, okay. This is the section of the pectoral region. So this, all the structures will be covered by the pectoralis major muscle, like this. So it lies deep to the pectoralis major. So you remove the pectoralis major muscle, you see the pectoralis minor muscle. Above is the clavicle, here is the subclavius muscle. Okay, so that's the clavipectoral fascia as it appears from the side. You're taking the section and looking at it from the side. Now when you look at the clavipectoral fascia from the front, this is how it will appear. Okay, so this is the pectoralis minor muscle. Subclavius is the clavipectoral fascia attached here above to the subclavian groove. Below, at the upper border of pectoralis minor, divides into two layers, covers the pectoralis minor muscle. At the lower border of pectoralis minor, it forms the suspensory ligament of the axilla that keeps the floor of the axilla pulled upwards like a dome. Medial, it blends with the coracoclavicular ligament, lateral with the costoclavicular ligament, and also anterior intercostal membrane of the upper two spaces. Now there are a few structures piercing the clavipectoral fascia. There are basically four structures piercing the clavipectoral fascia. The four structures piercing it are these: the thoracoacromial artery, cephalic vein, lateral pectoral nerve, and lymphatics from the breast. Okay, so what is the thoracoacromial artery? Thoracoacromial artery is actually a branch from the second part of the axillary artery. Cephalic vein is the continuation, right? The cephalic vein is formed on the dorsum of the hand in the roof of anatomical snuff box from the lateral end of the dorsal venous arch, joined by two veins from the thumb, one vein from the radial side of the index finger. We will talk about the veins in another video. So this cephalic vein continues along the lateral side of the forearm, lateral side of the arm, lateral to the biceps brachii. Then it enters the deltopectoral groove. Then it pierces the clavipectoral fascia. Then it opens into the axillary vein. So the cephalic vein, on its way to drain into the axillary vein, pierces the clavipectoral fascia here. We can also see the nerve, that is the lateral cord of the brachial plexus is seen here. The lateral pectoral nerve can be seen piercing the clavipectoral fascia here. Alright, so this is the axillary artery here, this one. axillary artery. The second part of it, we have the thoracoacromial artery. This should be covered by the pectoralis minor because the second part of the axillary artery lies deep to the pectoralis minor. So this branch should come from here, thoracoacromial artery piercing the clavipectoral fascia, and this lymphatics from the breast to the axilla. Okay. So what are the structures piercing the clavipectoral fascia? So mainly we have four structures piercing the clavipectoral fascia. So the structures piercing clavipectoral fascia. One is cephalic vein. Okay, cephalic vein. Then we have thoracoacromial artery, also known as the acromiothoracic artery. Both same, acromiothoracic artery. And then we have the lateral pectoral nerve, and we have some lymphatics, efferent lymphatics from the breast. Okay, so the structures here are call structures, CALL, call structures piercing the clavipectoral fascia. This is cephalic vein, cephalic vein, acromiothoracic artery, lateral pectoral nerve, and lymphatics. This is the structures piercing the clavipectoral fascia. Right, coming to the applied anatomy. So the congenital anomaly of the pectoralis major. Sometimes the pectoralis major muscle may be absent. Okay, it may be associated with the agenesis of clavicle, as in cleidocranial dysostosis. The pectoralis major muscle, when it is absent, it looks like this. As you can see in this picture, the pectoralis major muscle is completely absent. Okay. Then the rupture of the subclavian vessels following fracture of the clavicle. See, the subclavian vessels lie very close to the subclavian artery. So the fracture of the subclavian artery may be associated with the rupture of the subclavian vessel. If the fragmented piece of a clavicle punctures the subclavian vessels, it may result in profuse bleeding. And there is this condition called the winging of the scapula. This is due to the paralysis of the serratus anterior muscle due to injury of the long thoracic nerve. That's called the winging of scapula. So that's all I wanted to discuss with you today. So in today's class we discussed the pectoral region muscles and the clavipectoral fascia. Thank you very much for your patience.